Assalamu alaikum. I am Dr. Asma Hosna, Professor in charge, Department of Pathology, Bashundhara Ad-din Medical College. Welcome to you all today's pathology online session. Today I am going to discuss about the topics, that is cell injury. At first we have to know what is cell injury. If the limit of adaptive responses are exceeded, or if cells are exposed to injurious agents or stress, deprived of essential nutrients or compromised by mutation, a sequence of events follows that is termed as cell injury. And the cell injury is reversible up to a certain point, but if the stimulus persists or severe enough from the beginning, the cell surface irreversible cell injury and the cell death is occur. And the cell death is the ultimate result of the cell injury. There are two principal pathways of the cell death, and that is necrosis and apoptosis. Now, what are the causes of cell injury, or what are the stimuli that causes cell injury? At first, oxygen deprivation, then there are some physical agents, chemical agents and drugs, infectious agents, immunological reaction, genetic derangement, nutritional imbalance. First of all, oxygen deprivation. You have to know what are the causes of hypoxia, that means lack of oxygen, and the causes are reduced blood flow, this is called ischemia, and inadequate oxygenation of the blood due to cardiorespiratory failure, decreased oxygen carrying capacity of the blood as in anemia or carbon monoxide poisoning or blood loss. These are the causes of hypoxia. In physical agents include mechanical trauma, extremes of temperature, sudden changes in atmospheric pressure, radiation and electric shock. The chemical agents and the drugs include simple chemicals such as glucose or salt in hypertonic concentration, oxygen in high concentration, poisons such as arsenic, cyanide, mercury salts, etc. And there are some infectious agents like virus, rickettsia, bacteria, fungi and parasite. And in immunological reaction, it may occur in anaphylactic reaction to foreign protein or a drug, reaction to endogenous self antigen, that is called autoimmune disease. Genetic derangement include Down syndrome, sickle cell anemia, inborn error of metabolism, etc. In case of nutritional imbalance, it included protein calorie deficiency, specific vitamin deficiency or nutritional excess. This is about the causes of cell injury. Now come to the next topics, that is mechanism of a cell injury. How the cell injury is happen or occur. The molecular mechanism responsible for cell injury and the cell death are a complex process. The cellular component damaged by injurious stimuli are mitochondria, cell membrane, machinery of the protein synthesis and packaging, and DNA. And there are four biochemical themes that appear to be important in the mediation of cell injury and cell death. And these biochemical themes include: number 1, oxygen and oxygen derived free radical; number 2, intracellular calcium and loss of calcium homeostasis; number 3, ATP depletion; and lastly, defect in membrane permeability. Then come to the point how ATP depletion is occur. Reduction of ATP is the fundamental cause of necrotic cell death, and we know that the ATP produces by two pathways. One is oxidative phosphorylation of ADP, that means adenosine diphosphate, and another one is glycolytic pathway. What are the major causes of ATP depletion? When there is reduced supply of oxygen and nutrients, the ATP will be depleted, then mitochondrial damage and some toxin like cyanide. We know that the ATP is required for all the synthetic and degradative process in the cell, and it is about membrane transport, protein synthesis and lipogenesis. When the ATP depletion is 5% to 10% of normal level, it has a widespread effect on many critical cellular systems. The activity of the plasma membrane energy dependent sodium potassium pump is also reduced, and so there is a failure of this active transport system causes sodium to enter and accumulate inside the cell and potassium to diffuse out, and the net gain of solute is accompanied by isomorphic gain of water causing cell swelling and dilatation of the endoplasmic reticulum. The supply of the oxygen to the cell is reduced, and so there is oxidative phosphorylation also ceases, resulting in a decrease in the cellular ATP and associated increase in adenosine monophosphate. And so these changes stimulate phosphofructokinase and phosphodiesterase activity, that leading an increased rate of anaerobic glycolysis from the glycogen. And so as a consequence of glycogen store are rapidly depleted, and then anaerobic glycolysis result in the accumulation of the lactic acid and inorganic phosphates from the hydrolysis of the phosphate esters, and this reduces the intercellular pH, resulting in decreased activity of the many cellular enzyme. So ultimately there is a failure of the calcium pump that leads to influx of calcium with damaging effect on numerous cellular components. With the prolonged and worsening depletion of the ATP, there are structural disruption of the protein synthesis apparatus occur, and which is manifested at detachment of ribosome from the rough endoplasmic reticulum and dissociation of polysome with a consequence of reduction in protein synthesis. In cells deprived of oxygen or glucose, protein may become misfolded, and misfolded protein triggers a cellular reaction called the unfolded protein responses that may culminate in the cell injury and even cell death. And ultimately there is irreversible damage to the mitochondrial and lysosomal membrane, and the cell undergoes necrosis. This is the picture showing the mechanism of a irreversible cell injury. So at first showing that there is a presence of ischemia. When there is ischemia, that is lack of oxygen, inadequate oxygen supply. Ultimately in the mitochondria there is oxidative phosphorylation, this will be reduced, and so the net result will be the ATP will be reduced. And when the ATP is reduced, first effect on the sodium potassium pump, so ultimately there is an influx of calcium and water and sodium within the cells and efflux of potassium from the cells. And so ultimately there is a endoplasmic reticular swelling, cellular swelling and loss of microvilli and blephs. Subsequently, when ATP reduced, anaerobic glycolysis is also increased, and ultimately the glycogen will be reduced and the lactic acid will be increased. As the lactic acid increase, so the pH will be decreased, and so the nuclear cramping of the chromatin. And lastly, there is detachment of the ribosome, so the protein synthesis also decreased. This is all about today's session, my dear student. Inshallah, in our next class we will discuss about the other mechanism of cell injury. Till then, Allah Hafiz.